These are happy and healthy infants. Unfortunately, not all children are born this way. These babies were born with birth defects, some physical and some cognitive, including behavioral issues, language difficulty, and reasoning issues. Most of these birth defects could have been easily prevented. These birth defects are a result of teratogens. About 25% of birth defects are due to genetics. The rest come from teratogen. A teratogen is an external agent that causes harm to the embryo or fetus. Some common teratogens include drugs, tobacco, aspirin, caffeine, alcohol, environmental pollution like mercury or lead, maternal diseases like rubella or AIDS, or even bacteria and parasitic diseases. Exposure to these harmful teratogens can lead to low birth weight, premature birth, placenta previa, stillbirth, behavioral problems, learning disorders, and asthma.
The most common teratogen to date is alcohol, affecting more than 40,000 newborns each year. When a pregnant woman consumes an alcoholic beverage, the alcohol enters her bloodstream and circulates through her body, then transfers to the fetus through the placenta. If this event occurs too often, the baby can develop a multitude of birth defects and diseases. The most severe problem is fetal alcohol syndrome, which is a combination of multiple defects that begin during the prenatal development stage. Fetal alcohol syndrome often leads to severe birth deformities, heart defects, mental health problems, stunted visual and auditory systems, and learning disorders such as Down syndrome and cystic fibrosis. In a recent study conducted at the Mother Risk Program, it was revealed some possible dangers from medicines exist as well. A variety of common allergy and pain medicines contain different levels of ethanol, which affects the alcohol concentration in each dosage. If the recommended adult dosage contains 10 to 20% alcohol concentration, then a daily dosage could equal the same amount of alcohol as an alcoholic beverage. While it is still most likely safe to use these products during pregnancy, women should be aware that the products do in fact contain alcohol. Through studies recently, it has been revealed that there is no existing safe level of alcohol consumption during pregnancy, so women who are pregnant, might be pregnant, or are trying to get pregnant should avoid alcohol entirely in order to fully prevent any damage or complications.
In the article, Prescribing Without Evidence, Thomas and Yates discuss the effects of prescription medicine on pregnant women and the lack of information. Prescribing of medicines during pregnancy is common and for some groups of women is essential for maintaining maternal and fetal health. Pregnant women and prescribers are concerned about the potential adverse fetal effects of medicines. These may include fetal death or stillbirth, congenital malformations, developmental impairment, neonatal effects, or late carcinogenesis. It is therefore essential that the risks and benefits for mother and fetus are considered carefully before prescribing during pregnancy. This is often challenging because there is not much information available. To complicate the issue further, drug pharmacokinetics are commonly altered in pregnancy, potentially affecting optimal dosing as well as interpretation of plasma concentration measurements. Specific information on individual drugs is rarely available. Most drugs do cross the placenta in pregnant women. Active membrane transporters also have an important role in enhancing or preventing drug transfer, although this is not yet clearly understood. Animal studies have limited applicability to humans because of species-specific effects, and clinical trials in pregnancy are only undertaken in special circumstances. Prescribers therefore need to rely on observational studies of fetal outcomes following drug exposure in human pregnancy. It remains essential that appropriate mechanisms for systematic data collection, including congenital malformation registries, teratology information services, pregnancy registers, and linked population registries are maintained and enhanced to increase the amount and quality of information available.
The Role of Prenatal and Maternal Stress in Child Development is a scholarly article written by Janet A. DiPietro that talks about the notion that women's psychological state during pregnancy affects the fetus is a persistent cultural belief in many parts of the world. Recent results indicate that prenatal maternal distress in rodents and non-human primates negatively influence long-term learning, motor development, and behavior in their offspring. The relevance of these findings in human pregnancy and child development is considered in this article. Overall, the article provides evidence that potential mechanisms through which maternal psychological functionings may alter development of the fetal nervous system are being identified by current research. but it is too premature to conclude that maternal prenatal stress has negative consequences for their child's development, although mild stress may be a necessary condition for optimal development. Teratogens also have psychological effects on fetal development. The beginning of a successful foundation for life starts the second a woman becomes pregnant. Awareness about the possibility of teratogens causing developmental issues is needed to ensure a safe, normal, and sociable future for the child. The psychological effects are very detrimental to a child's emotional, social, and educational endeavors throughout life.
Being aware is key to keeping your infant safe.